Hello, everyone, and good evening once again. Dr. Alalade here at Ask the Gynecologist. I've not yet checked my audio. I'm sure that we are all on the right course today. And once again, I want to say thank you guys for joining me today. I know it's been a wonderful time, busy time for me. I've not been available recently, but it's all good. Sometimes we are busy for a reason. So I'm grateful and I'm so happy to be here with you live. Today is an open session, open clinic. I'm hoping my audio is good, so I'm just checking things here quickly for myself. If you can hear me, let me know. If my audio is good, let me know, okay? If anyone can hear me loud and clear, just give me some thumbs up on the screen. If you can't hear me, let me know so I can change my direction or change my audio as I'm talking. So welcome once again. It's going to be an open house session, and I'll be taking questions from everyone so that I can answer questions as much as possible today. Obviously, you'll know that in 2 days' time, that's on Saturday, it's a seminar for the month, and it's going to be on reliable gender selection. So if you're not yet registered for that seminar, just go and do that now without delay. And if you've already registered, we will have sent you a link on your email. Follow the instructions in your email and join the seminar group now. So if you can hear me loud and clear on Instagram, on Facebook, please kindly give me thumbs up. It's going to be an open session. Today is Thursday, and by the grace of God, tomorrow, Friday, we're going to have a sex masterclass. On Friday, we're going to have a super sex masterclass free of charge to everybody. So tomorrow, make it a date, 8 p.m. tomorrow, all things being equal, by the grace of God, we'll be here talking on how to improve our sex life. So make sure that you are here tomorrow, live, by the grace of God. But without much, so if you can hear me loud and clear on Facebook, on Instagram, please kindly give me thumbs up. Please, I need to know so I can do my quick audio check. If you can hear me loud and clear on Facebook, on Instagram, please kindly give me thumbs up, please. Now. So welcome once again and good evening. My name is Dr. J, one of your admins at Ask the Gynecologist, and I'm so happy to be here. And definitely, I'm sure you have. ATG is Ask the Gynecologist, and we are one of the biggest resource group on gynecological issues on Facebook today. And we talk about female problems, gynecological problems, infertility problems, and how they can be tackled, how we can make women's life better regarding the period, ovulation, regarding their getting pregnant, sex life, and ovarian cysts, everything that pertains to uterine prolapse, miscarriages, ectopic pregnancy, everything that pertains to the life of a woman, the health of a woman, of whether your sister, your daughter, your niece, your wife, your mother, things that happen in the lives of women. And definitely, obviously, half of the things we talk about here on ATG is about infertility because that's what people want to hear. But we still talk about other things as well that are necessary and that they are important in the lives of women. So if you're free, join me today. It's going to be an open session, so you can ask your questions. Let me quickly scroll up on Facebook here. I can see Vivian Diko Breaks, Ibine Dion Part, Awele Johnson, Bumi Falano. And I'm just trying to scroll here on Facebook. I can see more names on Facebook. So if you can hear me loud and clear, please give me thumbs up. Here I can see Udora DK, Drug Stitches, Okay Kenkechi, Antonia Nkem Epenisi, Adetutu Tawa Kalitu, Stella Nwakocha, Nabu Philippa. Good evening. So if I've not mentioned your name, it's just because I've missed it, but I'm looking at you. Faith Daudu, Ike Chinyere Nwana Jermaine, Chiamaka Jindu, Kauna Bature. Welcome, Kauna Bature, all the way from Kaduna, Okano in Nigeria. Lovelyn Yemilo Ishaya Arua, Adeoti Akintemi. Lovelyn is saying that what is the cause of hormonal imbalance, doctor, and how can it be corrected? So we'll talk about hormonal imbalance today and how hormonal imbalance can be corrected. There's a question from Ulebube Favor. What drugs can I take to achieve hormonal balance? So the number one question here is hormonal imbalance and how can we correct hormonal imbalance? So that's number one question. Let us look at other questions too. We'll group the questions in batches and then we'll answer them. My name is Dr. Alalade, one of your admins here at Ask the Gynecologist. Faith Ijoma Philip Stella Benny Okafor, Father Shade Oludele, she can hear me loud and clear. Faith Giwa, Irene Udu, Anyotayo Blessing Funke, Grace Amechi, Divine Osaje. Good evening. Mary Mumuni, Eva Vicky, Oreton Omoni, Deborah, Jesse, Chiamaka Chiobi, Divine Kelechi, Ogume, Doris Nath, Atiwegu, Ehi Oduwari. We have on Instagram, the names on Instagram are like nicknames, like acronyms. So it's difficult to pronounce the names on Instagram. We have Sheila Benny Okafor, Juliet Mangaya Stevens, Antonia Nkem Ekpenisi, Happiness Davids, Olanike Ogundikwe, Chiamaka Jindu. Remy is saying that, is it good for a woman to menstruate twice a month? Ijoma is saying, can one check for breast lump via scan? That question is gone. I saw a question about, okay, hello from Cameroon. Got Esther Obi from Cameroon. Can one check breast lump? Can one check for breast lump via scan at 28 weeks pregnancy? So there's a question here about checking breast lumps via scan at 28 weeks of pregnancy. Why is IVF chances always 50-50? Okay, there's a question. So let's start taking questions now about hormonal imbalance. Then we'll go to the question about breast scan at 28 weeks. Then we now go to questions about IVF. Why is it 50-50? So I'll take those 3 questions now. Then after, I'll start taking other questions. So now the question time is closed. Now listen to the answers. So now when we say hormonal imbalance, let me tell you something. There are many hormones in the body of a human being. There are many hormones in the body of a woman. But we're going to focus on reproductive hormones for the purpose of this, for the purposes of this discussion. And these hormones we focus on, about 6 of them. The FSH, follicular stimulating hormone, LH, luteinizing hormone, the thyroid stimulating hormones, about 3 of them, the testosterone, D21 progesterone, and anti-Mullerian hormone, about 5 or 6 of them. These hormones we focus on. And if there's any derangement, and also the prolactin, if there's any derangement in either of these hormones, it will make you not to ovulate regularly or have issues with ovulation or even have ovarian failure. And if you have ovarian failure, becoming pregnant becomes a difficult thing, and it becomes a difficult step approach. So that is hormonal imbalance. So if we know, now, if you want to treat hormonal imbalance, first of all, we need to know which hormone is imbalanced or which hormones are imbalanced. So we need to do all these simple tests. Prolactin, say, it's expensive now, but we know addictions. When I'm not a babalawo, I'm a doctor. I'm not a Dr. Lawo, I'm a Dr. Babajide Alalade. So I have to do this hormonal test to know which hormones are at fault of all these 6 or 7 of them. And if I know which ones are at fault, whether 1 or 2 of them or 3 of them, then I'll treat them with appropriate medications. So there's no one medication to correct all hormonal imbalances. If it's that one, then you go and meet babalawo. But if it's for gynecology, obstetrics, gynecology, you want to treat hormonal imbalance, we need to know which hormone is imbalanced. In most cases, if you have a regular period, it's because of hormonal imbalance. And we need to know which hormone is imbalanced, then we fix that. It's sacrosanct. Now, you can have period twice a month. It's possible. In a very common case, let's say your period happened January 1st, and you have a 21-day cycle. Definitely, you're going to have another period around January 29th. That is twice a month. So it depends on which month you're talking about. So it's possible to have period twice a month, but in most cases, it's very, very rare. If you're having period twice a month, you need to be very careful. It could be intermenstrual bleeding. And intermenstrual bleeding is usually a sign of something sinister. It could be a fibroid, it could be a polyp, or it could be something even much dangerous, like cancer. So we need to know all this, okay? Fibroid, polyp, abnormal cells in your cervix, infections, they can cause you to have intermenstrual bleeding. That is important. Now, a question came about, why is IVF 50-50? You see, IVF is trying to simulate or stimulate or say copycat or what God does in silence. I tell people all the time, nature works best in silence. If you see anybody making noise, they don't know what they're doing. Nature works best in silence. And that's how nature works. Nature works faster. So, as doctors, we want to stimulate or try to produce a baby in the laboratory. We have the incubator, all these things, the counters and that. We're trying to simulate what the body does effortlessly. Now, all the things we do in the IVF section, whether to stimulate the womb, stimulate the eggs, retrieve the eggs, incubate the eggs, fertilize them, put it back, okay, into the woman's body. Along the line, anything can go wrong. Even after putting the egg, fertilized egg back into the woman, it can even miscarry. Anything could go wrong. That is why it's always 50-50. And in fact, if you're trying to get pregnant, IVF at advanced stage is even less than 50-50 chance of success. But it can be doable. So you have to open your mind. And during IVF, don't stress yourself. Okay, by adding an unnecessary emotional stress to yourself, from your husband, from family, it increases the risk of loss or pregnancy, or loss, or failure rate during the IVF process. A woman's body is very tender. Take care and take care of it with extreme care. That's number one. There's another question somebody asked me about doing breast scan at 28 weeks of pregnancy. Usually, if you're going to do to scan your breast tissues in pregnancy, is not very good, because the breast tissue is much denser during pregnancy, and the breast scan is not very sensitive to detect issues or problems with the breast during pregnancy. But if we have high suspicion of possible disease or possible malignancy or cancer in the breast during pregnancy, then doing a breast scan is advisable. But in most cases, if there's no issue of previous lump or strong suspicion of something sinister or something very disastrous in your breast, we usually leave breast scan to be done after delivery. Hold on, guys. I'll open the floor for questions now again. There's a question here. Somebody is asking a question about, can Clomid be taken more than six months? Once you are taking Clomid for four times, and you know you get pregnant, you should just stop. Doing the same thing over and over again and not getting the result is actually not nice. If you've taken Clomid for up to 4 times, it's not worked, just stop it. It's not going to work. Just stop it. That's it. Can someone ovulate during their period and get pregnant even when the hormone is not balanced? It is true, but it's not always true. It's very rare for you to ovulate during your period. Okay, it doesn't make sense, but it's possible. I never say nothing is impossible, because I'm not God, but it's unusual and unlikely for you to ovulate during your period. But I've seen people that they get pregnant when they have sex around that period, but it's very extremely rare. It's not the norm. It's not the norm. Okay, so don't go and start having sex during period. Say I didn't say so. Okay, doctor, I did hysteroscopy on the 14th of this month because of additions and missed period. I've been on Progenova since 2 weeks now. Today, you did a transvaginal scan and they found a 3.4 centimeter fibroid or something like that. That question is gone. You have to hold on so I can read all these questions properly, because everything is so fast. So anyway, which is better, Clomid or Femera? No, there's no one better. It depends on individual circumstances. No, not one is better. It depends on individual circumstances. Okay, very good. Now let me adjust my camera here. Good. Is it advisable to undergo adenomyomectomy if you have adenomyosis? If you have adenomyosis, okay, you can have it taken out if it's possible. But in most cases, it's difficult to take out adenomyosis. But if it's possible, if the doctor says you can take it out, that is fine. There's a question here on Instagram. Is 8mm lining good for IVF? No. We want your womb to be at least 12mm thick, endometrial thickness, for IVF. What happened when monthly friend stop at age 48? It's probably that you've gone through menopause. If you've stopped seeing your monthly period at age 48, you've probably gone through menopause. So Eudora DK is asking, how can you correct PCOS? Another question here on Instagram, Chocolate Beauty. Doctor, what could be the reason for someone not to see a menstruation after miscarriage? You see, after a miscarriage, it takes about 6 weeks to 8 months before your periods start back regularly. So it's common. It can happen. After a miscarriage, some people will see their period immediately. But for most people, about 60% of them, they'll see their period start regularly back around 6 weeks to 8 weeks after a miscarriage or after a C-section. I noticed swelling in my neck and you're not pregnant. What could you do? Go and see your surgeon. Let them examine your neck quickly. When is it best to take Clomid? During your period or after your period? People, I don't know. I want to answer that question. They want to start doing babalawo things. A friend had a miscarriage, inevitable abortion. Our gynae gave her some drugs to help the baby stay and help strengthen our hormones and help taking the womb. After 2 weeks, She went for a scan. After that, she had been having white odorless discharge. Her gynae said she should menstruate last week, blah, 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 blah. What is the question? What is the problem? I don't understand. Evening, doctor. If after progesterone test, I can't see. I'm not getting lost now. They are just too much. Guys, slow down. Let me take this question in batches so I can answer everybody. By putting this thing too fast, I'm human being. I'll just freeze. Slow down. Slow down. Princess Infunaya, so your friend had a miscarriage. She was not. This is too long. What's the question? The issue here is that I don't understand. This is second miscarriage. She should go for a scan, and if they can't see baby heartbeat on scan, they should repeat the scan in 2 weeks. And if they still can't see baby's heartbeat in 2 weeks, that means that that miscarriage is done. Is a miscarriage. How can one lower prolactin? Take bromocriptine medications. Okay. It will bring your prolactin down. Take it for at least 4 to 6 weeks. Repeat your prolactin level at the end of the 6th week and you see if it's coming down. If it's not coming down, you see your doctor. They might need to increase the dose or change your medication entirely. Hello, Mochibala from Instagram. Hello, Omotomo and Lady Empire on Instagram. Dr. JP Dave. Doctor, she's pregnant again after miscarriage. How possible will this one stay? I don't know. I don't know. But she should be registered under proper antenatal care in ATG or with a doctor locally. When will someone with 24-day cycle ovulate? Just go and embrace EJ. Watch my videos on ovulation on our ATG YouTube. I've done about 3 videos on ovulation. Watch it there. I explain a lot of things graphically. Watch the video on ovulation on YouTube so that you can come up to speed. Probably you just joined our group so you can come up to speed by watching that video. Doctor, please, what other sign can someone see when ovulating? I don't focus on seeing signs on ovulation. If you're waiting for a sign to see, to know you're ovulating, welcome to waiting. Don't wait for any particular sign to be seen to know that you're ovulating. That is a waste of time. Don't wait to see any particular sign to know that you're ovulating or not. That is not what I don't do that business. I don't go by all those signs. They are very, very non-reliable and inconsistent. After doing all the investigations, your gynae tested you, you're okay, you're not getting pregnant, what can you do? You ovulate every month, your period is regular. So if you are doing all this and you're having regular sex 2 to 3 times a week for at least 1 year to 2 years and you're not yet pregnant with all these tests normal, my sister, go for IVF. Don't waste time. Doctor, is it safe to have vaginal delivery after C-section? If after 1 C-section, you can try for vaginal delivery next pregnancy, as far as there's no other issue with that second pregnancy. But if you've done CS twice, go for C-section again. Don't even ask that question. Instagram here. Doctor, which day of one cycle should one start going for follicular tracking for someone with 28-day, 29-day cycle? Follicular tracking from day 9 of your cycle, starts going for follicular tracking. So go for follicular tracking on day 9, day 11, and day 13, and also on day 15 if possible. Okay, so just do that. Okay. Hello, doctor. Is the endometrium thickened by medication during IVF? Yes, we have some medications we give to thicken the endometrium during IVF for the IVF purposes also. Jackie Franco is asking for the YouTube link of ATG. Please, can you help me give Jackie Franco the YouTube link for ATG? In fact, if you're watching me now, you should be subscribed to our ATG YouTube. On the ATG YouTube, you'll be able to watch all our old videos in chronological order. In Facebook here, so many things can change on your timeline and you're not able to see the chronological orders of our video. But if you go on our ATG YouTube, you'll be able to see all the videos sequentially, chronologically, and you can follow things. If you need to do infertility test and you are not sure of what to do, please just call our laboratory tomorrow morning. That's tomorrow morning 9 p.m. and the lab manager Nike will go through all the tests you should do, and they'll tell you the price, and you can get your lab test done for infertility at our ATG laboratory. And once you do your test at ATG laboratory, once you do your test at the ATG laboratory in Lagos, we are only in Lagos for now, but you can do your test at any reputable lab. But if you do your test at our ATG laboratory in Lagos, you get all the tests reviewed by me for free. Okay, and next week we're going to start our hysteroscopy. Our hysteroscopy equipment was just delivered from America today to our ATG Center, and we're going to commission it next week, and we'll start our hysteroscopy facility next week. So if you need hysteroscopy done, you can get registered from next week, and you can call Nike, the lab manager, tomorrow, and she'll start taking registration for our hysteroscopy if you need it done. And for our hysteroscopy, what we do is that all the videos are HD quality. We record them in a USB for you if you want. But what we do, if I was cheaper, is that we put the USB, your videos of hysteroscopy. Hysteroscopy is look into your womb. With all the videos we get from that camera, we put it on our ATG archive, and we'll give you the link. So you can download the link and keep it forever for yourself. You can take it to your doctor. You can share with your other doctor for second opinion, and it's yours to keep so that you can know what we saw in your womb and what we did, how we treated you, so and so forth. So you can take the video anywhere, and we'll give you a report to take as well with you. Our ATG laboratory and the IVF center and the hysteroscopy unit is in Lagos, and the address will be put up on your screen shortly. Chichitina is asking, what can be used to treat infection in pregnancy? In pregnancy, you can have any infection, but thrush infection, yeast infection is so common in pregnancy. First of all, we need to take swabs from vagina to know what infection you have. Infection can be caused by many things. So we have to take swabs from your vagina to know what infection you have, then we treat them accordingly. There's a question here. Do you offer IVF at the ATG Center? Yes, we do offer IVF at the ATG Center. Yes. Oh, you should know that already. Now, the next one is, what is the cost? The cost is very easy. Now, many people will need IVF for many reasons, and we have different categories of IVF. Some will need straightforward IVF, some will need egg donor, some will need sperm donor, some will need this, some will need that. Okay? Some want to do gender selection. Okay? All this cost, call the lab manager tomorrow, and they will give you all the breakdown, all the cost, simple. Okay? I don't have all these things because they are extensive, and it's not easy to go through them on this kind of discussion. So call the laboratory tomorrow, and they'll go through all the details with you. What hormone is responsible for PCOS? Usually your LH hormone, FSH hormone, and the testosterone. What causes bloody discharge of cervical during ovulation? Probably because you're having sex now. Thank you, Vivian, for putting the address of the laboratory to Nana Musa. Can the right tube pick up egg from left ovary during ovulation? Yes, it can. They can cross pick. Right tube can pick up egg from left tube. Left tube can pick up egg from right ovary. So they can cross pick up egg. Good evening, doctor. I did HSG last month. I haven't seen my period for this month. You did home test of pregnancy? Oh, that is gone again. I couldn't see that question. Oh, God. Oh, Jesus. Anyway, that question just went away. You did test of pregnancy is negative. So if you've done HSG, okay, your period could be a bit scanty, or it could be a bit unsettled for the first maybe 4 or 5 weeks. So expect that. Okay, after HSG, after hysteroscopy, after fibroid surgery, after a miscarriage, after a DNC, your period could be slightly irregular for the first 4 to 5 weeks. Okay, so that is not unusual. Doctor, what can one take? Pregnancy, something. Doctor, it's gone again. Jesus. Doctor, what could be the cause of hot peppering sensation from waist down, sometimes on the hand? Cause of peppering sensation, waist down, sometimes in your hand. It's probably your nerves. It's probably so it's not your vagina or ovary. It's not your womb. It's probably what we call neuropathic pain. So get to see the neurologist. Let him examine you. Doctor, you are seeing milky discharge in vagina, in the lower abdomen, pain. Can I conceive with mucus, so and so? You don't have to see cervical mucus to get pregnant. Again, you don't have to see cervical mucus to get pregnant. Doctor, what causes pregnancy sign without being pregnant? Because you're not pregnant. Hello? What causes pregnancy sign without being pregnant? You're not pregnant. That's it. It's your mind. What causes someone period to be very every month? Varying for 28 days to 30 days, 32 days is hormonal imbalance. Get all your hormones checked at the ATG laboratory. Can pregnancy be 1 week older than gestational period? What could be the cause? Some people like to make or complicate themselves. Which you are trying to I don't know. Are you trying to ask questions to know how God does his business? If you're pregnant, you're pregnant. If you're not pregnant, you're pregnant. If you're pregnant, you do test of pregnancy, it's positive. If you're not pregnant, they're not pregnant. I've seen people come to me, doctor, I'm having this feeling, I'm having that feeling. Should I do test of pregnancy? I think I'm pregnant. I not ask them, have you done test of pregnancy? No. Then do it now. I don't want to do it. I think I'm pregnant. Then do, if you think you're pregnant, do test of pregnancy. Doctor, I want to know more about selected IVF regarding genotype. Yes, we do it at Atg Center. We can do genotype testing before your IVF so that we know, and we can even test the fertilized egg to know what genotype is going to have before we implant. Okay, but it's going to come at it's not free, it's at a cost though. Can pregnancy be 1 week older than gestational period? I don't understand that question. What are the symptoms to see during ovulation? Breast tenderness, being moody, slippery discharge, you feel horny, you feel angry, sometimes you just want to pounce on your husband, sometimes frequent urination. Yeah. Can IVF be successful with idosarpings? Very unlikely. Doctor, I did a pregnancy test, it's showing negative, you haven't seen your period for this month. Repeat it in 7 days time. What is hormonal imbalance? Hormonal imbalance is if any of your hormones, i.e. FSH, LH, progesterone, prolactin, testosterone, AMH, if they are imbalanced, that will cause hormonal imbalance. Which is the best, Ovumine or Clomid? I don't know. What is the first day of fertile period for day 28 cycle? The first day of your fertile window is from day 9 of a 28-day cycle. So have regular sex every other day. I tell people, don't wait for ovulation before you have sex. If you wait for ovulation to have sex, you are wasting your time. If you're waiting for ovulation before you have sex, you are wasting your time. And you are wasting God's time. You can't waste God's time. You are wasting your time. Because if you have regular sex, maybe every 3 days, every 2 days, you are likely to get pregnant. If you do that, as opposed to having sex only during your ovulation. The only time you're free from sex is during your period. Every other time, you should have regular sex every other day, every other day. That increases your chance of getting pregnant very, very significantly. Doctor, what causes umbilical? Doctor, please, umbilical hernia surgery, can it be done during CS? It can be done during CS delivery, but we avoid it. They can repair your umbilicus during CS, but that means we have to call the surgeons in to do that. But we usually try and avoid that. Is squatting safe exercise during the last trimester as to quicken labor? You can use your bouncing ball. Okay, they help a lot. It helps to widen the pelvis and allow air to engage, and sometimes may even make labor happen faster. But there's no guarantee of that, shall. Okay. You've been taking Can HSG delay period? Yes, to an extent. On Instagram here, doctor used to have cervical mucus every day, even when you're having menses. What is the cause? It's normal. Doctor, can a woman get pregnant with just one fallopian tube? What can she do to get pregnant with just one tube? See, if you have one OK tube, this is on Instagram now, and the other tube has been blocked or taken away, if you ovulate from any of the ovaries, the OK tube can go and pick up egg from that ovary. Either way, whether on the same side or on the other side. There's nothing you do extra. You pick it up. Okay? Your breast is bringing out water. You're not pregnant. Go and do your prolactin test. Nana Musa is asking for the address. Nana Musa, Vivian just gave you the address. Please, thank you, Vivian, for giving Nana Musa the address. Someone is saying that, can she do an IVF without seeing your period? You can. You can. If you want to do IVF and you're not sure what to do, after listening to me, you can just call our IVF center tomorrow. And there's a doctor there, she's an IVF lady. Call that doctor there, Dr. Chuma. She'll see you. She'll go through your history. She'll tell you what test to do if you want to hear, and she'll give you your results. And she'll tell you what's the best thing to do to get pregnant. So call to the IVF office tomorrow, talk to the manager, or talk to the doctor there, and they will find a way of seeing you and they can do your test. They can know what you need. They can know what type of IVF you need specifically. How long does someone that had a C-section have to wait before getting pregnant again? I'll say wait for at least 6 months to 1 year before getting pregnant again. After doing all the investigations for gynecologist test me I'm okay, you ovulate every month, your period is regular, you can't get pregnant, then you have to do IVF. If you're ovulating regularly, you're having regular sex every other day or every 33 days, you've done that for 2 years, yet you can't get pregnant, IVF is the next thing to do. Forget, let's be honest. If you've been doing regular sex so every other day for 2 years, you've done all your tests, they're all okay, and yet you can't get pregnant, your man less than 35 IVF. You've been doing regular sex more than 35. You're doing regular sex for a year, no pregnancy, and every of your tests they're all okay. IVF. If someone is menstruating twice in a month, how can she calculate ovulation? You see, this ovulation business, is a time waster. If you're having a irregular period and you can't calculate your ovulation, then the best is to have regular sex every 2 or every 3 days. The only time you're free from sex is during your bleeding. The only time you're free from sex is during the red cap. See, my truth is already dry. The only time you're free from sex is during your period. All this thing of ovulation, my breast is tender, I'm saying egg white. Yeah, wasted time. Get pregnant too. Forget all those things. Anybody telling you to be looking for ovulation, egg white, all those things, they're just wasting. They're just trying to complicate gynae. And if something is too complicated and you can't explain it to a 2-year-old kid, that means it's useless. Anything you can explain to a 2-year-old kid is a waste of time. Okay, so just make it easier. Make it easy, self. Regular sex. You can't beat that. Anyway, can someone who has gone through CS once and wants to try vaginal birth and get the squatting is safe? If you had one C-section, you can try vaginal delivery and squatting is safe. Can a woman get pregnant with just one tube? Yes, I already had answered Morenike. How many weeks do I need for IVF if you come from USA to Nigeria to do IVF to our ATG IVF Center? Please budget at least 6 to 8 weeks, minimum 6 weeks. And if you're going to come a week before your expected period. Come a week before your expected period, so that we have that 1 week before you period before when you come. So if, for example, your period starts next week Friday, fly and leave America today. Once you get to Nigeria, go to the ATG IVF Center, get registered. If you don't have regular period, then see your GP or your family physician in America or in UK, wherever you are, and let them give you some medications to help you to have withdrawal bleed. Once you know when you're expecting that withdrawal bleed, according to the schedule of the drugs you're going to be given, you can now plan your trip to Nigeria so that your bleeding will happen a week before you come. It will happen a week after you arrive in Lagos. Okay, I hope I'm making sense. So get to Nigeria basically a week before your period. Can someone with fibroid do IVF? Yes, it depends on the fibroid size though. If the fibroid is bigger than more than 5 centimeters, it will be beneficial and reasonable to take it out before you go for IVF. Okay, yes, all right. How long can someone get pregnant after stopping Noristat? If you stop Noristat injection, in most cases you should really get pregnant within the next 4 weeks. Okay, thank you Vivian for putting up the address of the laboratory. Oluchi, I've already answered your question about fibroids. Let other people answer or ask a question. Doctor, sir, someone suggested 50-20 times squatting in the morning and night from 7 months. Is it not too much? It's not too much. But if it's, you have to listen to your body. If doing that is making you stressed out, panting, and it makes you excessively stressed, it's not for you. Somebody that does 50 squats before they got pregnant, they will do 30 even in pregnancy. Someone that was never doing anything before they got pregnant, now they want to do 10 squat during pregnancy, they will not do shishi. So it's what you're used to. It's how you've been training your body. It's what your body is used to. Okay. Can dustiness reduce prolactin? Yes, it can, but you must use it with, Thank you guys for I can see you all on Instagram. Doctor, I need your number for your IVF center. Bodisere is asking for the number of the IVF center. Please, Vivienne, Christina, any of our team members out there, can you please give this wonderful lady, thank you, Vivienne, for giving Bodisere the link for the IVF office. So Bodisere, call tomorrow morning, 9 a.m. they open, and then talk to the procurement or talk to Nike. Doctor, you did fibroid surgery last year. Till now, no pregnancy. You haven't watery discharge. It's hot. It feels hot anytime. Come from vagina. You have color, so and so. You need to do hysteroscopy. So do hysteroscopy, okay? Get hysteroscopy. Go and do hysteroscopy. You're feeling breast pain for 2 weeks now. You haven't seen your period. You're supposed to something. Then do a test of pregnancy. Do a test of pregnancy. What causes low progesterone? Shortened luteal phase. Question here on Instagram. Doctor, how do I know if I have an ovulation? You do your LH hormone, you do your FSH hormone, you do your testosterone, and then we know whether you have an ovulation or not. Okay? What is the average cost of IVF? About 1.1 million without drugs. By the time they had drugs, probably about 1.3, 1.4 million. But without drugs, ATG IVF Center, 1.1. If you're an ATG Premium Services member, we give you discount of 100. We take a 100K from your price, okay? So if you're an ATG Services member, ATG Premium Services, we take off 100K from your total bill. If they didn't tell you, let me know, and I'll give you a discount of 100K from your total bill. Lady Emma is asking, how much is hysteroscopy? We just bought equipment today. We'll set it up next week, and we'll give you the price of about 280. And our hysteroscopy is diagnostic and operative. So we see the problem, we treat it there and then. We don't tell you come back again. If we see any problem in your womb cavity, scar tissue, ovarian, something, so what, fibroid, polyp, we take it out. Biopsy, we take it out. We treat it. We see, diagnostic, and we treat immediately. So you don't go back and forth. It's one sitting. Okay, so our price is the same, whether it's diagnose or we want to do diagnostic and hysteroscopy. And we record the video HD and we give it to you to take care yourself. We give it to you within 24 hours, okay? And we give you a report as well of everything we found. Doctor, after doing all the investigation, Adeoti, Akin, Temi, I have already answered your question twice. Can endometrial polyp go on its own without removal? It can, but in most cases we have to remove it. So hysteroscopy, to Lady Empire here asking me on Instagram at ATG IVF Center, is going to be 280. So that is for hysteroscopy, to see into your womb cavity and to treat any problem there. If we take biopsy from your womb cavity, it goes to laboratory in LUT to check and to look under microscope for any tissue we remove from your womb. That one is separate fee for biopsy and for pathology. But just to see, enter your womb, treat any problem there, in and out, is 280. Okay, straightforward, easy, done. And it's going to go up because dollar is affecting the tubes we buy for the scope. Because when we bought the scope 2 months ago, before the scope arrived in Nigeria, from clearing and forwarding, you see the naira has gone up. So it's already chopped up at least almost 5% of our cost. So if you're not ready to do hysteroscopy, just call tomorrow and talk to Nike manager. She will book you for hysteroscopy, and then she will get back to you with your date and time and appointment. Okay, so don't dull. If you wait, if you snooze, you lose it. It's going to go up again because the dollar is affecting our naira. You want to do IVF for twin boys? How much will it cost? Call my secretary tomorrow morning. She'll give you the cost of IVF and also family balancing to choose your design. Okay, doctor, please, you asked me to do hysteroscopy. Will they know the cause of why I'm having hot discharge? Yes, they will know. How long can I take for menses to return to normal after Dopemu injection? For Dopemu injection, it could take up to 6 months to 12 months before your period starts. Water coming from your breast, get your test done to check prolactin at the ATG laboratories, okay? Is blocked tube treated too? If your tube is blocked, okay, we can't do that on a hysteroscopy. It's a different thing entirely. That is idiotubation. Idiotubation is not with hysteroscopy. Hysteroscopy is a different thing entirely, to see into your womb cavity and to remove any fibroid that is small inside the womb cavity, polyps, take biopsy, remove lost intrauterine coil, and so on and so forth. If your tubes is blocked, then you might need to have idiotubation. But even though, having said that, idiotubation only works for 1 out of every 4 patients. Okay? I can't answer all questions because it's so extensive. Thank you guys for joining me today. Hope to see you soon. I'll be here on Friday tomorrow to talk about sex. So don't miss the date. Set your time, your alarm to be here at 8 p.m. tomorrow. All things being equal by the grace of God. See you soon. Love you all, and bye-bye.